Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Well, welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. And boy, have I enjoyed getting to know Dr. Meg Mill. Welcome, Dr. Meg.
Hi, thank you so much for having me.
Oh, it's a joy to have you. Folks, you are in for a treat. How many people do you know have headaches? And here we are on Vitality Made Simple. We've talked about, about 200 topics, and we've never talked about headaches. But we have Dr. Mill. She's a doctor, has a doctorate in pharmacy, but she was trained on the conventional side, and then she became certified in functional medicine. And I think her world just got turned upside down. So it's wonderful, Dr. Mill, that you are an expert in the pharmacy side because that's big for headaches, but now you're seeing it from a different standpoint. How did all that happen?
Yes, well, I think that, when we're talking about headaches specifically, this is a really important distinction because when we are looking at it from more of a conventional side, most of the treatments for headaches are really about treating the symptoms. So we're looking at treating pain. And so my personal journey actually in my own health situation where I was going to different doctors. I knew the protocols of why things were being prescribed. Like I'm even working in hospitals on patients with these protocols, and we're just saying, okay, we're band-aiding things. We're putting medications on, but we're not really getting to what is happening, why this is happening. And so it was really, my own health journey that made me make this change. And so now I really want to get into the way I work with people is really looking at the root cause and what are all the things that are going on within a unique person that's causing you to have these symptoms. And so, like I was said, when we're talking about headaches and migraines, we're saying, okay, here is the conventional treatment. You're told one, which is, awful. I hate when people are told this, that, this is just something you have to live with. You could think, okay, I have a headache gene that doesn't really exist. There are certain genes, SNPs that make you maybe more likely to have headaches, but we can work around them. And then we're given things that are going to treat the pain. So when we're looking at this from a functional perspective, we're saying, okay, let's flip that script and look at it from you are a whole person, and the pain that's coming from your headache is happening because there's imbalances going on in your body. And so what do we actually need to do in your body to bring it back into balance, to look at all the things that are connected so that the pain actually goes down? So we start to see this decrease in pain level, and then like the severity of the headache, and then the incidence. And it happens over and over. I've worked with people who have like chronic migraines every day to being headache free. It's really a huge transformation.
You really do change their relationships in that case because so many people, their headache, takes them out of commission, takes them out of the game in terms of even getting to be around their friends or family. I want to go back to what you said about the headache gene. I think that is so key. People just ignore the potential of getting better. So when somebody comes into you, Dr. Meg, and they say, I've got headaches, but they maybe think you're going to give them painkillers, and you say, I can really help you. Where do you start that unravel?
Yeah, so it really depends on the person. So, what we do is I have a virtual functional medicine practice and I see people all over the world, and before they even come, I have them fill out detailed health history questionnaires, lifestyle questionnaires, symptom questionnaires, and I review that before we even get started. And then we really go deep dive. We do a 90-minute appointment that dives into who is this person and what are all the unique connections for this individual person that we need to bring back into balance that are going to help the headaches get better. And really it can be different, and sometimes it's really interesting. One day, I wrote down there's like about 50 different things that can cause headaches and migraines, but there's usually a different combination for everyone, and some can be really simple. Sometimes you can come to me and we can find the thing. Maybe there's just one thing or three things for you, and we can find those fast, and you can say like, okay, life changing within a month. And other people, it just takes a longer time to put these pieces together. Actually, years ago, I share this story because years ago I had two sisters that came to me at the same time. So they actually started to get, I think they saw my information out there. They're like, okay, we need to do this, and they started coming at the same time. And they both had, their mom had, like you mentioned with the headache, she and their mom had headaches. They both had headaches, and one sister, within the like a month or so, her headaches were just gone. She was like, I can't even believe this. This is magic. Like, what did we do? This is just life changing. And the other sisters weren't. So here it's like, okay, they both start with me, and it's like this huge change. And then hers are not better. And I like, she didn't say it to me, but I acknowledged her and I said, I can see how that has to feel to you. Like, why have I not changed? And
Mhm.
everyone just has a different combination of things, the reasons, and we still have to work on what are all the reasons that you're getting the headaches and the migraines. And within about 4 months, hers were then also gone too. But it's one of those things, like I just am highlighting, that everyone has a little bit of a different journey. So it's really about being, we become health detectives, and we start to say,
Yeah.
okay, what are all the things for you that we need to put into place to get your symptoms to go away?
Yes, that has to be pretty shocking because I think a lot of people too think, oh, I just need to detox. I've heard you
I
speak to
know, yeah.
this. Give us your wisdom on detox.
That's funny that yes, I think people do need to detox, but not first. And that's the problem. I think a lot of people are out there talking about detox protocols, and you're like, okay, I need to detox. But if you're not detoxing from a place of strength, you could be definitely making things worse. And I have had way too many people come to me after doing different detoxes, that they said, they're with, maybe you're seeing a person that's running a detox program online, and then you're going to join it and everybody does the same thing, and that's
Mhm.
not the right thing for you, because if you don't have all your drainage pathways open, if your body's not coming from a place of strength, the detox can actually make it worse.
So what do you see people doing that's the most dangerous in that area?
Well, so in order to, when we're detoxing, it's kind of a push catch. So we're pushing the toxins out. We have to catch them and eliminate them. If you don't have open elimination pathways, so if you're not going to the bathroom every day, if you're not sweating, if you don't have enough hydration, if you don't have certain things happening in your body, and maybe you have high levels of beta glucuronidase in your GI system, there's certain things that if you're not eliminating the toxins, if you're pushing them out of the cell, if you're saying, okay, move toxins, you're coming out of the cell, but they're not actually leaving the body, you're actually going to get more toxic burden on your body. And so sometimes people can become more sensitive, have more reactions, because they're not detoxing appropriately.
So you touched on constipation. I mean, Dr. Meg, I am shocked at all the people constipated. As a
Mhm.
dentist, probably 20 years ago, I started asking people, tell me about your bowel habits. And so many people would say, well, they're non-existent, and you'd find out they only have a bowel movement every 3 or 4 days. So as you're saying, they're not eliminating. So these things are recirculating. And
Yes.
then I think that's so key. So, how would you, if somebody's constipated and they're having headaches, what first steps would they have?
Well, we do need to get them to have a regular bowel movement. So we need to be able to, make sure that they're moving their bowels. And that's going to be different again for everybody. Why, if people normalize that, they're like you're saying, okay, they just think, oh, I only
Hmm.
have a bowel movement every 3 days and that's just normal for me. Well, that doesn't mean that it's actually normal. Just because that's your
Right.
norm isn't what it necessarily should be. So we need to make sure that, are you having a bowel movement? Are you moving your bowels at least once a day? But then, deeper than that, if you're not, why aren't you? So
Right.
what's actually going on that is keeping you constipated? And so that's why we're looking at layers. So I always say, like, okay, we're peeling the onion back,
Right.
sort of. I'm looking at all of these layers that are talking. Our bodies are talking, like it's crosstalk between your hormones and your gut and your head and your nervous system and your immune system. Our our medical system is bucketed into specialties. And you can see why, because if you're getting heart surgery, you want that heart surgeon to be focused on the heart and know everything about the heart. And you want, that's important. But the problem is our body, we're one body and everything's talking to everything else. So when we're looking at it in this separate way, like in neurology, in gastroenterology, in gynecology, in immunology, in all of these different departments, and they're not speaking to each other, then we're not really seeing that full body connection because all of these things are connected to each other.
Yeah, I think we so often forget the connection. It's so relevant in my area with the oral microbiome and how that impacts the gut microbiome as well as the blood brain barrier. And so it is so key. Um, Speak to environmental toxins. I think, Dr. Meg, that people forget about things like heavy perfumes, you know, personal care products. I've heard you speak on this, and I really love your perspective.
Yes. So, what is, when we're talking about environmental toxins, we're looking, I've heard the word used exposome. So, like, what are you exposed to versus the fact that you can actually digest, like, metabolize and detox? So, we need to be able to look at your own, everyone's going to have an individual ability to detox based on our genetic makeup. So, based on your own genetic makeup, how well do you naturally detoxify and what is your exposure level of things you're bringing in, and we need to keep that in balance. So if you're having a lot of exposure and you're not detoxifying well, you're going to have this high toxic burden that we're talking about. So we need to do things that can clean up your environment. So what are things you can do every day to, you can put air purifier in your bedroom. You can say, okay, do I need to clean the air that I'm breathing? I say bedrooms because they're, it's
Hmm.
expensive to put them all over your house. So you spend half the time in your bedroom and you're sleeping, your body's rejuvenating. So that's a place you can start. How is the water you drink? Are you drinking clean water? You can go to ewg.org and actually
Hmm.
test. They have on their
Hmm.
website now, like looking at the toxins that are in your water, like contaminants. So that's a neat thing to look at. Or do you have a reverse osmosis water system? Like, what kind of water do you drink? Are you, like you mentioned, the BPA, the plastics? Do you eat out of plastics? I had one time I had someone who, it's just so surprising that some of these like organic whole foods companies that are like prepping meals. So they prep your meals, you're spending all this money on these like special meals, and then they give them to you in plastic containers and tell you to microwave them to heat them up.
Right.
And
Or
you're like, okay,
styrofoam.
that's backward, or
Hmm.
styrofoam. Yeah,
Hmm.
that's
Yeah.
backwards. So, okay, let's say, how should we be putting, like, packaging our food? We're going to put it in glass. When you heat plastic, it's going to melt into the food. And so, we're not thinking about things like that. So you have to just start to take all of these things into consideration because they can be part of this whole dynamic.
Yes, and I think it's so many things we don't think about. I had a patient in who was having severe headaches. She was constipated, and she just radiated with a really strong perfume. And so,
Um,
it's a touchy thing to say, well, a starting point, maybe put your perfume away.
yes.
But she was just so ready. I mean, and she did, and she's like, in 3 days I felt better. I
Hmm.
mean, something that can just be so normal, common in the environment might be a trigger, as you say, for that specific person and maybe putting a toxic load on that overfills their bucket.
Hmm. Yeah, absolutely. And most of my, like, people I work with are very sensitive. We start, and you start to, like, yeah, the smells, there's chemicals, like natural flavors, natural
Yeah.
smells. Like, that means like a lot of times chemicals that, so what can you do to bring down that load? And that's a good point because you're thinking, okay, that's just something I've always done. That's my
Hmm.
habit. but can we change some of those habits just to bring down the load? And that can make a big difference in the way you feel. And so, like some of these things are, some of these things we're looking at mitochondrial function, which, is complicated in cellular health and the gut microbiome and all of these things. But then some things are very simple, like taking away your perfume or even hydrating. So an
Right.
independent risk factor for headaches is dehydration. Do you hydrate? Do you put electrolytes in your water? Like, do you sip? You need to hydrate at a cellular level in order to really benefit from a headache perspective of hydration. So, are you gulping your water down all at one sitting, or are you sipping water through the day and maybe adding electrolytes? When we're talking about headaches, though, you have to be really careful with electrolytes because a lot of electrolytes have citric acid in them, which bothers a lot of people that have headaches.
Wow,
So,
that is good to know. I did not know
mhm.
that.
So you have to really be on the lookout for what ingredients are in your electrolyte too.
Okay, so folks, if you're suffering from headaches, read your labels and look for citric acid. Great
Hmm.
point, Dr. Meg.
Yeah, most of them have it. You have to kind of look through and find unflavored ones often will be good. But we want to make sure that you just, look at that citric acid in the label.
Boy, that's a pearl. Well,
Mhm.
tell us about exercise when it comes to headaches. Many people feel better exercising, but as I've learned from you, that may not be the whole picture.
Yes. Well, and that's some, there's going to be a lot of factors when we're thinking about that. So I would say, movement is good. So
Hmm.
you do want to move your body, but you also want to be careful when you're exercising and like evaluate your cortisol levels. So if you have low cortisol and you're over exercising, you're pushing your body into that adrenaline. So you're pushing your body into like that fight or flight, and we often see, okay, the fight or flight response. I sometimes call it the chain of pain, so pain.
Mm.
So we'll take a step back. So stress on the body pushing you into fight or flight can be like psychosocial, where we're saying, okay, it can be from your thoughts, it can be like,
Right.
the to-do list, all of that, but it can also be physiological, so it can be biological. So if you're having stressors on your body, you can be in fight or flight from those stressors, which increase your pain sensitivity, which then push you, so then the pain can actually put you in fight or flight. So it's kind of like this
Yeah.
chain that
Right.
people get into, like where they're in pain, pain's putting them into the stress response. The stress response is creating more pain, which puts them into the stress response. So
Hmm.
we start to get to see, yeah, cortisol dysregulation. And so then we need, when we're looking at exercise, what is where are you within what your body's telling you? So it's not as much like don't move, but move in a way that's serving your body. Don't push yourself when you're not feeling well, when you don't like, are you empty? Do you feel like, okay, I'm empty
Hmm.
and I'm pushing myself, or does it feel good to you? And what are maybe some more gentle movements that you can do, again, and then we have to look at structurally too. So like if you're pushing
Yeah.
your with your neck and your alignment and things like that
Hmm.
too, that can affect headaches.
No, it's great information because I think we too often get into the one size fits all
Mhm.
mode. And oh, I should be doing, hit exercises. I should be doing CrossFit. I should be and that, as you teach, just may not be at all the best thing
Mhm.
for your own physiology. So Dr. Meg, for the listener who's suffering from headaches and who has thought, "Oh my goodness, I think I have the headache gene," but wait, now there's hope. What foods would you tell us are potential triggers, common
Mhm.
triggers?
So foods are complicated. So when we're talking about headaches, there's two different buckets that we're looking at when it comes to food. So one are the common foods that we know can trigger headaches, and then we also look at food sensitivities. So I don't do food sensitivity testing on everyone I work with, but I have, just over working with hundreds of people with headaches and migraines. I will do that often with people with headaches and migraines because there are some very unique food sensitivities that people come up with. So, for example, I used to run a program called Headstrong, and that was a group of we would work with women over time with headaches and migraines. And one of the people years ago in that group, I just point her out because it was, a big discussion within that group was she was drinking protein shakes with no, with pea protein because like dairy is a common food sensitivity. Everybody, people will just, if they're just blanket statement, a lot of people, they'll say, okay, give up gluten, give up dairy,
Mhm.
they're without really individualizing. So she was told, okay, give up dairy. So she went to pea, and then we did the food sensitivity test. Peas were her highest food sensitivity. So just making that switch from the pea protein shake back to the whey protein shake really had an effect on her headaches. And so it could be these like healthy foods that you think like, oh, I'm doing this for a reason, or I'm trying, I've seen cinnamon or like turmeric come up high where people were, eating the ginger, like things that are
Mhm.
you're doing to be healthy, and those are what your body's responding to and reacting to right now. So that's one. Those are called IgG food sensitivities. That's different than a food allergy. Those are IgE food reactions, but we're looking at food sensitivities. They can cause headaches. Then we have another bucket where we're looking at common things that cause headaches. So those are things with like histamine containing
Mhm.
foods. A lot of
Mhm.
people that have headaches and migraines have issues with histamine. So we'll often try, exploring low histamine, tyramine to containing foods. So that's like aged cheese and meats. We have nitrates, which would be like hot dogs and things like that. MSG is in a lot of prepared products. We see issues with salicylates. So that's another one that can be in citrus. So that's something that you might not be thinking like, okay, lemons could make you have headaches that you're not necessarily thinking that way. We also see caffeine that can actually help you feel better, but too
Mhm.
much caffeine can be an issue. And then we also see like aspartame and things in like
Mhm.
diet soda. So there's these groups of food. Now, it's all about the load. So that's what also gets tricky. It's like, okay, here's all these foods. I have food sensitivities. I have histamines. I have tyramines. Like, you start to feel like, okay, what can I actually eat? And it's really more about exploring your limits, your reactions, because it's individualized. It doesn't mean like you're going to react to every single thing, but it's like, what is your overall load? And it can be different depending on different things. So for example, estrogen actually has receptors on mast cells, and mast cells release histamine. So, in times of ovulation or right before your cycle, especially like if you're perimenopausal and maybe have some lower progesterone than estrogen, if you're estrogen dominant, you could be more likely to have a headache from a histamine containing food than you could at your follicular phase, like right after your period. So and that's why people say, okay, well, let's just use wine. Like I had a glass, it's a huge headache trigger, but you could say I
Mm.
had a glass of wine at, like this time, and I had a migraine, but then I had a glass of wine another day and I was fine. So it's not the wine, but it could be the wine. It could be the wine at the time of month when your estrogen's at a higher level. So there's a lot of different factors. There's a lot of different, like, okay, did you eat this food and this food and this food together? What is your overall load? And people really, it's been amazing to watch people really get in touch with those kind of variants and their own personal overall load to see, once you understand it, you can navigate it.
Remind our listeners what exactly histamine containing foods are. So many are on the healthy list.
Yes, yep. So that's a good point. And so, and that's another thing where it comes into a lot of things where we do gut healing, like the traditional gut healing protocols have a lot of histamine containing foods. So you might even being told by a practitioner to eat some of these foods for gut healing, but we have to do gut healing a little bit differently when we're looking at this. So things that are fermented are
Mhm.
so like the fermented foods. Bone broth is another one. Again, a gut healing food. Bone broth's histamine. Avocados or something. Then we have things like strawberries, Tomatoes are another one. So there's a long list. I can actually give you, I have an essential guide to histamine intolerance. It's a free guide that lists, it's a really detailed list of all these foods. So we have a guide specifically on headaches, but I can also give you the histamine guide too. And then that way people can download, because it's a pretty long list. Certain, they can say, okay, what foods are in here, so they have a better idea of what to avoid and what to actually add.
That would be great. We could put that in the show notes for our listeners to connect them back to you. And your website is just a wealth of information.
Oh,
I
thanks.
so appreciate that you give people hope in the area of headaches. I've just known too many people who wake up and wonder if today's going to be a day they have a headache.
Hmm. Yeah, that was actually one of the people I worked with years ago said I that was like a great quote that she gave me. She's like, I just love like not feeling like today's going to be another headache. Like, is today going to be a
Yeah.
headache day? And you just like, yeah, it is. It's like you don't know. It's so hard to plan things because okay, I plan my daughter's birthday party, but I have a migraine and
Yeah.
I'm out or we're on vacation. And sometimes like that's even another thing we look at when we're looking at environment. Like when you're on vacation, are you more likely to get a headache or are you less likely to get a headache because you're in a different environment? So it's really piecing so many different things together.
So is how does mold figure in uh,
Yeah.
this equation?
So yes, that is a factor. So that's one of the factors that we would look at. Now, again, when we're going through the layers, like it depends on the unique person where that looks like it fits
Mm-hmm.
in that layer. But if you have mycotoxins, if you have mold exposure, then your immune system is constantly activated because it's fighting the mold all the time. So it's like you might not even know you have mold and your immune system's like, hey, we have to work because we have
Mm-hmm.
mycotoxins in our system, which puts you on high alert and actually signals your mast cells to release more histamine. We've
Mm-hmm.
already talked about histamine can be a headache trigger. So there's a lot of different factors that go in there. And another thing that's like tricky about mold is that again, we're going back to your ability to detox. So five people could live in the same house and
Right. Right.
four of them could feel totally fine and one of them could have an issue with the mold. And that's where it's really confusing because you're like, I don't have mold in my house, no one else has an issue, it's not an issue with my house, no
Yeah.
one else has an issue, but everyone has different genetics too.
Right. And again, it's all the very layers, which one of those layers is perceived stress. So speak on, real stressors and perceived stress and how you help your clients deal with that perceived stress.
Yes, that we have to do a lot of thought reframing. And that's the thing. A lot of people say to me, "But I have so much stress in my life." And we're always going to have stress in our life. We can't control the outside. So there's going to be things that come up, that change, that we're going to have these stressors. But how can you regulate your own body to deal with the stress? So like how can you be in a parasympathetic nervous system no matter what is going on around you? And that's what we really need to work on. So we do a lot of different, I work on it in three different ways. So we do like the breath work. Well, actually, kind of four. Like, so we'll do the breath work, really using your breath to bring your body back in the parasympathetic. We do a lot of somatic work, somatic exercises. We work on vagal tone, and then we do a
Mhm.
lot of limbic system work to work on building that neuroplasticity and changing the thought patterns. Because, like you're saying, perceived stress, okay, well, it's perceived like if you can change that thought pattern, we can actually make your body have a different physiological response, which is really
Mhm.
amazing. But we have to work on that because a lot of these thought patterns are so sticky. You're going to do the work and then you're going to come back to that thought and then we're going to say, okay, wait, we're going to go back in and do it again.
I love that area, Dr. Meg. I went through the Mayo Clinic wellness coaching program years ago, and we talked about, neurons that fire together, wire together. So that's also known as the Hebbian law. And that is tough to redo because people, get in traffic, and traffic, traffic, and then they automatically go to that perceived stress. It's not a real tiger, but their body is reacting. And I can see that being such a big piece of what you have to work with for people that's often just sort of socially acceptable. You know what I'm
Mm-hmm.
saying?
Yes.
To be stressed or to be busy.
We wear it as a badge sometimes, like, oh, I see,
Exactly.
yeah, so much going on. And we have to just stop and say, okay, how can we calm our bodies down? How can we bring our body back into that parasympathetic and really start to have more control over what nervous system you're hanging out in?
Yeah. Give us a little more detail on breathing. I mean,
Oh, yeah.
what could a listener do right now? What simple
Mhm.
exercise to help get out of the stress mode into the parasympathetic rest and digest mode?
Yeah, there's a lot of different breathing exercises, but a simple, very like thing you can do right now is put one hand on your belly, one hand on your chest. Just breathe in through your belly. So breathe and then pull the breath up through your chest. Pause and then exhale and breathe it out of your mouth and like so envision it coming up and then when you blow out slowly envision it coming back down into your belly. So just like inhale, inhale, exhale. And just sit there for like 2 minutes and do that breath, just kind of think of it like a circle coming up through the belly of their chest up and then out slowly. And you actually, when you get good at it, you can start to feel your body actually relaxing. And that's why I say we need to build that muscle memory where your body knows, oh,
Hmm.
okay, I relax now. Oh, I relax now. And then you always have that tool because you breathe. So you have the tool available to you at any moment to just calm your body back down with your breath.
That's just wonderful. In fact, that just needs to be taught in kindergarten for
I know,
people.
really, it should.
It really should. And even with my clients with digestive problems, I pretty much start with helping them get into rest and digest before mealtime. I mean, with
Hmm.
just simple. That's a wonderful exercise you taught us. Simple breathing exercises, as well as sit down and put your fork down after every bite. Chew to liquefaction, and it's amazing how something that simple can really start taking the the problems away of just digestion, bloating,
Hmm.
burping. I mean, simple things.
Yes, I agree. I know. I used to, before, a long time ago, I would stand at my kitchen island and eat really fast and serve my kids, eat the leftovers, and then we'd like be running out to practices and whatever. And I'd
Mm-hmm.
feel like like my stomach hurt so
Mm-hmm.
much. And like, okay, well,
Mm-hmm.
you're eating exactly the opposite of the way that you should be eating. It was before I learned all of this wonderful information. But yeah, those simple habits can make a big difference.
Yeah, and I think that's what's so great about your website. There's a whole lot on Dr. Meg's website that you all can glean. She has a helpforheadaches.com. Right?
Hmm.
And
Yes.
an 8-step guide that can really help where you are. And I mean, Dr. Meg works with people for headache resolution, but to start with the simple things that really would be a great jump start before people call you,
Hmm.
correct?
Yes, yeah, put these practices in action. Say, okay, what are like simple things? Like we talked about hydration. Are you staying hydrated? Are you staying hydrated at a cellular level? Are you sleeping?
Hmm.
Sleep is another independent risk factor for a headache and a migraine. Like those are basic things that like, okay, can we sleep? Are we prioritizing sleep? Those kind of simple things, what start to become, and there's a list that you can go through in that guide, but it gives you things that you can start to do that are free, that are simple, that you can just say, okay, I'll put these things in my life. And each piece of that puzzle is one more piece towards a headache-free life, really.
Yeah, a headache-free life. It's possible. So,
Hmm.
so since you've learned these things, and obviously you've been a busy mom, you've been a achiever academically. So now, what is your sleep plan that you know, you've learned so much from your clients? What does Dr. Meg Mill do on it every evening?
Yeah, so
Or
my
ideally,
family,
what do you
yeah,
do
no,
ideally?
yeah, no, my family teases me because when we travel, I go around and like I just like cover all the lights in the hotel room. I'm like,
That's
Mom, you're so weird. And like, because the
duct tape.
black does, yeah, like makes a big difference to me, So I make sure that my room is cool, dark, and quiet, so I don't keep my phone in my bedroom. So I actually leave the phone downstairs because it's too hard to not look at it. So, I mean, I feel like
Yeah.
if it's there, sometimes we're just like grabbing it. So I actually keep it out of the bedroom. I do like, do some calm. I do calm myself down. Maybe I'll read a little bit before bed, but I just do some, wind down time. So, if you feel like, okay, I want to be asleep by 10 or 10:30, walking into your bedroom at that time isn't like going to
Mhm.
get you to sleep at that time. So like if you're trying to get a certain amount of sleep, like what time, how much do you need to like wind down to actually get there? Yeah, and then just, just keeping it like an optimal environment too.
Yeah, touch on social media and headaches. What are you seeing? As this escalates, what are you seeing in your client base?
Like as far as what people are saying out
Well,
there.
or social media, like what are you like the more social media people are on maybe and letting that impact
Oh, like the
their
blue light.
stress, well,
Yeah.
blue light as well, Dr. Meg, as even like the stress levels of social media. I mean, so many
Yeah.
people. I mean, I'm a couple of generations older than you, but in my world, and someone in their late 60s, like if I can just tell them, stop watching the news, stop,
I know.
you know what I'm saying?
Yes.
They're going to
Yes.
feel so
There's a
much
lot.
better
Yes.
metabolically.
Yeah, I know it's unfortunate. And look at our young generation. It's just hard. They're attached to their
Hmm.
phones and it's like I can't be anywhere without my phone. I'm on my phone all
Hmm.
the time and it's just getting more and more. So, I mean, I get like also evaluating how does it feel? Like when you're on that, those one, we can think of it from the blue light, the EMF perspective,
Right,
like you're
right.
constantly getting the EMF. A lot of people with headaches have issues with blue light. So, your eyes, giving your eyes a
Right.
break, all of that too. But then, yeah, does it, do you have an attachment? Do you have an addiction? Do you feel like you need that dopamine hit, in your
Hmm.
phone? Neurotransmitters are another thing that actually affect headaches. So, what's
Yeah.
your, hygiene, I guess you would say, when it
Hmm.
comes to using technology?
Yes, and that sort of segues with nature because I've found that people who are, here on their phone, staring at their phone, maybe are less out, looking at the birds and, feet in the grass and
Hmm.
that whole area of healing
Yes.
that's essential. What has been your experience there?
Yeah, I mean, I think connecting to like again, what I think everybody's a little bit different and what resonates with you as far as bringing your own self into the parasympathetic nervous system.
Hmm.
So, I mean, I think like grounding, walking in nature. Do you want,
Hmm.
I went for a barefoot hike one time. It was
Hmm.
such a different experience. Like,
Hmm.
I heard like, oh, try that. And I was like, oh, wow, it changes the whole thing. What
Yeah.
can you do to connect with nature? But think about like also just in general what resonates with you. So, some people like love nature and I think that that's a wonderful thing. Some people love to dance, some people love to sing, some people love to journal. So it's really finding like what are the things that connect you? What are the things that are calming, that are nourishing, that feel
Hmm.
good to you? And really try to do. Sometimes I have to tell people like do at least one thing for yourself every day. So, like, what's one thing you can do for you every day? And if you're busy, you're running around, you're doing everything for everyone else, but like, take a little bit of time and get some of the nervous system work in and do something that fills your cup.
That I think is fantastic advice because that's where people can start right now.
Mhm.
Like if you like to laugh, find some humor. If you like to move, get out and shoot some baskets or do a hula hoop or whatever. That's such a key to to health that we forget. I mean, and that's what's so great about your podcast. So to my dear listeners, Dr. Meg has a podcast called A Little Bit Healthier, and I think that is just the best name because it's where we all want to be. Wherever we are on the spectrum of vitality, we want to be a little bit healthier. So, how did you get that name? That's fantastic.
Yeah, so I have like I said, a virtual functional medicine practice, and I see people all over the world. And, a lot of people, we're doing big health lifts sometimes, like we're saying, these transformations. But I have this message of like, I think people can feel, there's some people that can feel really overwhelmed, like we're saying,
Right.
because it's
Right.
like, okay, can I make all these changes? Can I, and everyone can be a little bit healthier. There's things you can do every day in your life. It doesn't have to feel like this giant lift. There's things like we're saying one little small habit change at a time can really make big differences, especially when we add them up. So the point of the podcast is there's different things you can do every day to be a little bit healthier. And we talk about practical tips of things that you can get in your life in order to do that. So, really it is about taking your power back. I think we're in a world where we've given a lot of our health power over, like,
Hmm.
okay, to your provider, and you actually have so much more power than you realize to make changes. So, what can you do every day to be a little bit healthier?
Well, and there's no comparison there. It's just all grace and all freedom because you get to do what you want to do.
Yes.
You're not, racing against somebody else. It's just
Mm.
fantastic. Well, you are just a breath of fresh air. And if you're watching this on YouTube, you all can see that. Dr. Meg Mill is gorgeous and she lives she practices what she preaches. So tell us about how people can connect with you, what they can glean from you. As I said earlier, lots of people are suffering from headaches. Share this with your friends that just, oh, I've got a headache. And they think there's nothing they can do about it. But that is incorrect. That is a false belief that Dr. Meg has dispelled today. So tell us all about what you offer.
Yes, yeah. So you can come over, like we said, a little bit healthier. Join me over at the podcast. I love the community here on podcasts and all the listeners.
Mhm.
So love to have you. And then my website is megmill.com. Like you mentioned, there's a help my headaches.com, which we have a free guide over there. And I do have a program called Headstrong. We also have a community called the Women's Wellness Collective. So we're working together, like if with community, with what's like different things. Again, we're taking kind of that little bit healthier. What are things that we can work on? We have like
Mhm.
monthly topics. You meet with me, like there's a lot going on over there. So that's just megmill.com/collective. And I'm also over on Instagram at Dr. Meg Mill. It's just DrMeggmill. So yes.
MILL. Yes,
Yes.
yes. Just join her, folks. It's just wonderful. I appreciate the hope you give people in bite-sized steps. It's your program is not overwhelming. So thank
Thank
you
you.
so much for being with us today. And thank you, listeners, for being part of Vitality Made Simple. I think we're now in 136 countries and maybe 5,500 cities. We passed 100,000 downloads, so that's pretty exciting.
Yeah.
And that's all because of you all. I've been pretty slow to the social media, but now I'm on Instagram. So join me there or join me
Yeah.
on, of course, on YouTube. So thank you again, Dr. Meg. I really appreciate it. We'll put all this information in the show notes. And it's just been a joy to get to know you.
You too. Thank you so much for having me.
Yeah. And to my listeners, blessings until next time. So that'll be a great podcast. I think that'll get a
Yay,
lot
we
of
did
people
it.
over to your channel
Yeah.
and
And could you hear my daughter is homesick, of course, of all days, and it was like quiet all day, and then she must be watching a movie that like was going loud and soft, and I was like, oh my gosh, I
I
felt so
couldn't
bad. I'm
hear
like,
it.
oh good. It was like
No.
stressing me
Mm-mm.
out. I'm like, I was like, I don't want to stop because then you have to like edit it, but I was hoping you couldn't hear the
Yeah, not
background.
at
Like,
all. And I have
okay, good.
excellent hearing. I mean, I
Okay.
really, I really do have excellent hearing. So no, not a bit.
Yeah,
Not a
good. I'm
bit.
like, oh my,
Good.
because it's like, of course, like all day silent, and then it's like, I'm like, oh, okay, you put a movie on that now
Yeah,
it's gonna be the
yeah,
background. Yes, yeah, well,
yeah.
good. Yeah, no, thank you so much for having me. And I actually like, ironically, just had interviewed a dentist like about oral health just in January, but I would think it would be a great like to talk about about the oral microbiome, the blood-brain barrier. But so I'll reach out and, within the next few months, and would you like to come on as a guest?
Yeah, I'd love to. And my message is a little different because
Okay.
I talk about how the oral microbiome impacts the gut microbiome, some specific bacteria that
Okay.
food will boost, and then
Okay.
the blood-brain barrier. So it's
Good.
not
Okay. Yeah. Because
it's
it's
not
a
as
little bit different
teethy.
than yeah.
It's
Than
not
what
as
she was.
teethy at
Okay.
all. No,
Okay. Yeah.
I
Not that
kind
it matters, but it just like, because
yeah.
I was like, oh, I just had that, or about
Hmm.
orals, and but that was a little bit more about like fluoride and how to, like kind of more, a little bit more
Yeah,
fancy.
yeah. My
Yeah.
message is
Okay.
very different.
Okay.
Did you have who is the fluoride lady that I had on? Boy, it was awesome. Barbara, I'll think of it. But I was having so many ideas, Meg, through your interview about you need to talk to this person. You need to have this
Oh
person.
yeah. Do you have any?
Yeah. Oh yeah. I
Uh,
mean, I've had have you had Dr. Carolyn Dean on?
I have not. Mm-mm.
She would be really good for your
Okay.
audience. She wrote the Magnesium Miracle.
Okay.
And she emailed me, and I'll send you a contact information for her, a
Okay.
contact link. She wrote the Magnesium Miracle. She's a MD, naturopathic doctor, and she's probably in her
Okay.
70s. She's really sweet. I've had her on 2 or 3 times. We talked a lot about magnesium minerals, and it would go
Mhm.
great with headaches. And
Yeah.
she's very
Mhm.
willing to be on. Also, you could get an affiliate link to her product. She's got a really good Pico Nano
Okay.
magnesium, and you were talking about, I don't know if it's got citric acid in it though. I'm
Yeah.
gonna
Yeah.
go look.
Yeah. Yeah. Yeah.
I don't know. But I was thinking about her. There were several I was thinking about. So if you need ideas, just email me.
Yeah.
Because
Okay. Yeah.
I'm
And that's good to share. Yes.
yeah, no, and I'm fearless about calling people, and I'm a bookaholic, so I have just all these people.
Yeah. Do you pitch yourself on other people's podcasts too? Are you, when you're reaching out, are you just asking them
No,
for your stuff?
I'm really not doing that enough. Like I'd love
Okay.
to be on your podcast. I
Yeah.
mean, I'll talk about the mother-in-law bacteria.
Yeah.
There's that oral bacteria that travels to the gut, and it's actually so disruptive for the gut. And I can specifically talk about headaches. All of my patients, I don't know if you got my email, but I have a TED Talk, and all of my patients are physician referrals for chronic inflammatory illnesses. So I don't do regular dentistry at all.
Anymore.
At
Okay.
all. Yeah, I
Uh-huh.
do DNA testing, and I do GI maps on people. So I,
Okay.
tell
Yeah.
who's following you with beta glucuronidase and all that. So we can talk about how that goes with headaches. And then there are some things people can do at home that are pretty simple that
Hmm.
like a person I saw last week, she's already better with her headaches just based on me teaching her some things for her oral microbiome.
Oh, that's
People,
awesome.
yeah,
Yeah.
it's crazy, Meg. People are using a lot of harsh mouthwashes, killing their nitric oxide.
Hmm.
It's that onion you talk about.
Yeah.
I love your analogies because
Did you talk at A4M?
no,
Okay, because
not yet.
there was I listened to, it was such an overwhelming like weekend to remember who
Uh-huh.
gave but I listened to oral microbiome, like I sat in at one of those talks, and I was like, oh, might be that was, yeah,
Was
that was
that
good.
in December? Were you
December,
there in
yeah.
December? I was in there too. I was in there
Yeah.
too. It was somebody
I can't remember who it was.
Biocidin. It was somebody from
Oh, was it?
Biocidin.
Okay.
I did
Okay.
keynote the Biocidin summit yeah,
Okay.
yeah.
Yeah.
And so I talk about it from a real different angle. And so anyway, when you're ready, just
Yeah.
let me know.
Yeah.
Yeah.
Yeah. Yeah. I'll send you the link to schedule, and we'll get you on
Yeah,
there.
that'd be great. That's right. Well, thank
Great. Well,
you. Thank you
yeah,
for your
thank you so
time.
much. Yeah, it
And
was great to connect with you.
yeah, and just send me any of these links you
Oh
want
yeah, I'll send them to you.
in the
Yep.
show notes. Is your collective like a membership?
It's just a membership. Yep.
That's
Yes.
fantastic. That is
Mm-hmm.
great. No, send me
Yes.
information. I'll put that in there.
Okay.
So,
Perfect. Thank you. Have a
thank
good
you.
day, Debbie. Thank
You
you so
too.
much.
Thank you, Meg. Bye bye.
Thanks for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieosment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.